This hospital in China's Sichuan province pushed to the brink. COVID patients here now triaged. This doctor says those who've stopped breathing or who have no heartbeat are prioritized. It's tough to know just how bad things are in China. Official numbers are hard to come by. Still, whispers of a growing crisis are trickling out.
A lot of people are getting COVID.
Born in Wuhan, Bin Zhang lives in Calgary now with his wife and 2 kids. But the rest of the family is still in China, dealing with this latest COVID wave.
The hospitals are pretty crowded. Getting access to healthcare or even to medication seems to be a bit of a struggle nowadays.
Responding to protests over harsh COVID restrictions last month, China abruptly reversed course, quickly relaxing rules, likely fueling this wave.
There's going to be infections and hospitalizations and some cases even death.
The current explosion in cases predictable for many experts.
China has, since it's been now well over a month, a substantial wave in a population that we know, generally speaking, was relatively under-vaccinated.
As COVID cases ramp up in China, steps are being taken to limit the virus's spread outside that country. Starting Thursday, travelers from China will need a negative COVID test to fly to Canada, a move unlikely to stop the spread of the virus here.
It's going to be very hard to kind of police borders in the context of people being able to travel so easily and mixing of populations as we had prior to the pandemic.
Meanwhile, the COVID situation in China could soon get worse. The country is getting ready to celebrate the Lunar New Year, a holiday that will see millions of people travel around the country, many taking the virus with them. Aaron Collins, CBC News, Calgary.